So let's stay on COVID-19. Stigmatization is fast becoming a major challenge in the fight against the pandemic. Now, experts say this could have multiple consequences in various aspects of health beyond COVID-19. In light of this, the Mental Health Society of Ghana has launched an anti-stigmatization campaign to help address the challenges of mental health during the pandemic. Joining us via Zoom is the Executive Secretary of MESOC, Humphrey Kofi. Humphrey, thank you for joining us. Now, first, what would be your assessment of mental health care within this period of the pandemic?
Yeah, thank you very much. I think that we as a country had not prepared well enough to deal with the issues of mental health that were likely to come up as a result of the pandemic. Even as I speak to you, we still haven't done much because there are no medications in the facilities. If you go to the way forward now for mental health is to treat people within the communities. If you go to the polyclinics and other health facilities where we have psychiatric units, there are no medication. People go there and they can't get any better treatment. They don't have access to medicine. So what it is that much as this pandemic brings an overwhelming mental health challenge to either people who have contracted the pandemic or yet to contract, there are issues, underlying issues of mental health that has to be addressed to be able to get people prepared or to get people understand what are some of the nuances as this pandemic really affects many people across the country.
Now, let's talk about stigmatization and its impact on health, mental health. We know that stigma is fast becoming a challenge as far as COVID-19 is concerned. How has that impacted mental health within this period, and then what will be the likely consequence going forward?
Yeah, so this issue of stigma runs through our communities, and it is also because people are so ignorant about the pandemic and how it's really manifests. And the fact that people think that those who have contracted the pandemic or the COVID-19 are still not really treated because they have a little doubt of the fact that there are still underlying conditions related to the condition to the pandemic that are not really sorted out because there is no cure for it at the moment. It is important that we do a lot of education and awareness within the community because there is that correlation between mental health and then the pandemic. And therefore, if people have this understanding that, look, you cannot be cured or there's no way you have been cured, and therefore we should still isolate ourselves from you, then that is a problem because the post-pandemic consequences could be very dire. And I think that we need to step up the issues of trying to water down the effect of stigma and discrimination within the communities.
Well, what can we do? I know you have started a campaign. How is it going? And what are the measures you intend to put in place to help address this issue?
Well, so we're working with Star Ghana to be able to come up with fit for purpose messages that would go a long way to let people understand. Because first of all, we need to let people understand that the fact that you are worried, the fact that you are scared, the fact that you are anxious, the fact that you think that per your underlying mental health condition, you stand the chance of getting infected with the condition, does not mean that life is ended or you are definitely going to get it. And therefore, if you even get it, it is possible that you still live a normal life without necessarily having any suicidal thought because of the stigma and discrimination associated with it. So there is more that we're doing in terms of community sensitization.
Very well. Thank you very much, Humphrey Kofi. He is the Executive Director of MEXOC, joining us on the impact of stigma on mental health care in the country. You're watching News Text with me, and let me bring you some more stories. Scientists at the Crop Research Institute of the Council for Scientific and Industrial Research, CSIR, have confirmed apple tree, that's Malus domestica, at Etimetim Tabum in the Ashanti region. The apple tree, grown in a house, has numerous branches with few fruits. After 2 years of planting, plant physiologist and principal research scientist at the CSIR, Professor Beloved Mensah Jomeku, says there's nothing doubtful about the tree. JoyNews' Mahmoud Mohamed Nuruddin was at the site with the scientists and our reports.
If there is anything that